Welcome back to the Faculty Factory, friends. It's Kim Skorupski here at the University of Texas Medical Branch in sunny Galveston, Texas. And with me is a frequent flyer, Dr. Farzana Hoque. Hi, Farzana.
Hi, Kim. Very nice to be here.
Nice to be back, right? Because you might know Farzana from two prior episodes. Episode number 263, Embracing Culture Over Strategy, and number 274, EQ, Emotional Intelligence, for Unlocking Leadership Potential. And today, Dr. Hoque is back to talk about something brand new, a new piece of scholarship. I'll let her tell you all about it. Let me tell you who is Dr. Farzana Hoque. She is an associate professor of medicine and the acting internship co-director at the St. Louis University School of Medicine and the medical director of Bordley Tower at SSM Health St. Louis University Hospital. So again, welcome, Farzana. I'm so happy you're here again. And we can't wait to hear about your newest publication in the Journal of Brown Hospital Medicine.
Thank you, Kim. I'm very much thrilled to be here, as always. So this publication, I decided to write when one of my mentee, after she joined as a new faculty in academic medicine, and she was very intimidated that how she will bring herself as a new attending in front of the medical students and residents. And then I realized that when we are done with our residency, nobody teaches us that these things you need to know when you are teaching your resident how you should prepare yourself as an early career educator. And that was the motivation for me to write this scholarship.
Tell us about the framework that you posed in this article.
So, I was thinking that, how I can present all these tips in a framework manner that will be easy to remember as well as practical to implement for when we are teaching medical students and residents. So after multiple days of thinking, I came up with this framework called WISE framework, WISE. So W stands for watchful observation, I for insightful awareness, S for specific feedback, and E for empathic communication. And when I brought this WISE framework, my goal was to not only implement it for our internal medicine or hospital medicine educators. This framework can be also applicable by any educators, particularly for early career educators, regardless of their specialty.
That's what I really appreciate about this model. I love a model that is both elegant and applicable and generalizable. So when I was reading the article, I thought, well, this is great. And it's not just great for hospitalists. As you point out, hospitalists serve as the foundational brain architecture. And I thought, oh my gosh, I bet you a lot of practices think, us too, we're the brain architecture. So listen, let's learn more about the WISE model. So take us away. Let's walk us through the steps, Farzana.
Of course. So for WISE framework, first W, which is representing watchful observation. So, we cannot give feedback or we cannot tailor our education if we do not observe the learner, if we do not observe the students, the residents. So the first pillar of this WISE framework is watchful observation. So we need to observe, when they are taking history, maybe briefly, how they are doing physical exam, how they are giving the day-to-day update to the patients, how they are approaching the patient's family member, also how they are interacting with nurses. If we do not observe, we cannot give feedback, we cannot teach them. And our wisdom develops after observation. So the next pillar of his WISE framework is I, which stands for insightful awareness. So, if we are not aware about ourselves, about our thoughts, behavior, words, doesn't matter what we observe, we cannot give them the right insight. So, as an educator, as a physician leader, we must have that insightful awareness about ourselves, and meaning about our self-awareness, about how we are communicating with our students and residents. Because not all the students are same. Sometimes they will ask you a lot of questions, sometimes they will not ask you at all any questions. So having that awareness about our skills, about our shortcomings, it is very important. And next is a specific feedback. Nobody likes that feedback, okay, just read more, or okay, solve the questions. All of us, we want a specific feedback. And without a specific feedback, maybe it's one or two, our learners cannot grow. So we need to have that mindset as well as preparation beforehand the rotation, so that we can give them very specific feedback, that okay, which things, maybe two things they are doing well, which two things they need to work on in the next rotation. And last one, E, is for empathic communication. People really do not care how much we know, what is the title, how long is our CV, if they do not feel that, okay, we care for them. Same thing is for our learners. If our medical students, residents really feel that, okay, we care for their growth, we care for their development, we care for our patients, that makes a lot of difference. So how we are communicating with our learners, with our patients, everything teach them. It's not only about all the curriculum, it's not only about the literature, it's all about how we are treating them, how we are treating our patients, because we are also the role models for them.
Beautiful, beautiful. And I'm just smiling because I'm remembering your podcast episode on culture and how embracing culture over strategy. I can absolutely imagine how this WISE framework embedded in the culture at St. Louis will almost kind of like seep through to other divisions, other faculty, other learners, and then ultimately the patients. Because I can imagine as the educator using this model in my head to build relationships with my learners. And I can also see how this model would apply to a learner with their patients. Having the same watchful observation in the family system or unit, or who's with the patient when you're interacting with them, insightful awareness, being aware of their cultural or ethnic distinct nuances on how they would take information and how they would process your recommendations as a physician. The specific feedback, how are you doing? How have you implemented? We talked about what's been the challenge for you, how are the medications working out, et cetera. And then that empathetic communication with the patients. I can see how this is a vertical and horizontal integration that is just classic Farzana Hoque with culture and emotional intelligence. So kudos to you for coming up with this. And I can see the thread through your career and your scholarship.
Thank you, Kim. It truly means a lot to me. And, as an international medical graduate, I think, because there are a lot of IMG, International Medical Graduate, is in the United States health system. And our journey from residency to faculty, it's also a little bit different. Maybe who did their medical education in US or even in Canada, because understanding the cultural awareness, the expectation is very, very important. And as an educator, as well as a mentor, when I am teaching as well as mentoring the medical students from different cultural background, not only like maybe they are outside of US, maybe here, even they are here, but if somebody is coming from suburb versus somebody is coming from, very elegant family, having this understanding of their cultural expectation, like cultural base, is very, very important. For example, I had one resident who was coming always almost every day 10-15 minutes late. So I was very surprised. And then after 3 days, I sat with that resident and asked very directly, okay, what is going on that having this late? And that resident was very, very surprised because he told me that in his back home, everybody is late 10, 15 minutes. So he was actually very surprised that, okay, this is something different. So I believe, this is a very small example that how, as an educator, we also need to be aware about our awareness as well as cultural awareness that is our surrounding.
Wow, that's such a great example. I love that story, Farzana. Help us think about, as you're talking, I'm imagining someone who is an educator like you, you're mid-career now, and maybe people who are advanced career who are very certain and confident that something should be done a certain way. And because I've been successful doing it this way, it's efficient. I figured it out. I've done it 1,000 more times than you. And so I immediately, when I'm watching someone else do the thing that I do, it's obvious to me that that's different. Teach me how to have that mindful pause that surely I've been successful. That's why I'm the teacher. And is there any room for, instead of jumping down your throat, going, Dr. Hoque, wait a minute, you might want to think about doing this or that instead. Where is there space to go, maybe is a different style from me. Kim Skorupski, I'm a big mouth. I'm an extrovert. I talk to think. So my instinct is to be putting lots of words out there. And I always have to remind myself, shut up. Introverts, give them space, give them time, let them think before you get so uncomfortable with the silence, you have to start yammering. So where do we, and I'm kind of hinting back to your emotional intelligence, help me to be a little bit more wise or have some discernment about mandating things be done my way in this framework? How does that happen for you?
Great insight. And let me give you one example. I was talking with a seasoned program director. He was a medicine program director almost like 30 years. And he is born and brought up in US. And he told me that, during his tenure as the program director, when he had discussion with the international medical graduate residents, he had like challenge to find out. For example, he never understood that how these people do not have driving license, how, like, what kind of problem they are having with their housing, why they are not understanding, like, very commonly used all the American words. So these are like very simple examples, and I can bring my experience to you because when I came to the US first, I did not know how to drive. So I had to learn the driving after I was done with my work, then go to the instructor, learn the driving. So maybe the resident who had their training here, the program director, the faculty, they could not understand because here people get a license by like 16, 17. However, as an IMG, like, knowing the driving rule, and most of the country, they drive in different side than American. So it's like much harder. So this is a like, very maybe overlooked but critical experience I want to bring up here. Like, it's very easy for, as human being, for all of us, including myself, it's our human natural instinct come up to conclusion or judge right away. However, it is very important for us because, again, as you mentioned, as we are teacher, we are leader, we should be knowing more. So we have to actively remind ourselves to take pause, try to understand the situation before making the conclusion, because not everybody is at the same situation and not every day is same.
Beautiful, beautiful. That is such a great story. Again, you always have great stories to give examples, and that makes so much sense to fight the urge in this current environment where everything is rush, 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 hurry, 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 see as many patients as possible. You've got manuscripts piling up, you've got grant applications piling up, and classes and courses and learners and administrative responsibilities and all those things that it just makes our brains want to be efficient and want to skip ahead. And then that's often where I trip up because I'm trying to be efficient. I'm thinking this is just much more efficient if I just do it myself. And I think of my next door neighbor always bending down and tying her kids' shoes. And the sneakers are always getting untied, and she's always for down there tying her shoes. And I said, well, doesn't he know how to do it? Well, he does, but it just takes a long time. And I'm like, well, gosh, he'd probably get faster at it if he would do it once in a while, but you're always doing it for him. And it just kind of made me laugh to myself because it made me think, oh, don't I do that all the time? Thinking it's just faster if I do it. Yes, and it's faster now if I do it, or if I do it this way, that's how it works for me. But in the long run, or when I'm not here, or when other situations happen, I'm not doing anybody any favors by not letting them learn their best way to do it or learn a way to do it if I'm circumventing that process because I don't have time for that. So I think always comes down to me of time and my impatience. So that's what I always love a nice framework that, first of all, just a watchful observation that just tells you right there, you didn't skip that. You observe, close your mouth, open your ears, open your eyes, take stock, read the room. That is to me an organic, natural, built-in way that you're telling me, okay, let's take a breath. What's happening here? So I love that. I love how you do that.
Thank you, Kim. And about that watchful observation, as you mentioned, you brought a very good point. Like, as an educator, maybe, as a parent or as the like senior author, we are thinking, okay, maybe I will just do it. It will be much faster. However, if we are not giving the opportunity to the early career faculty, to the resident medical students to do those things, they will never learn. They will never be efficient. So what I practice now in my clinical setting. So for example, first I talk to the residents that okay, what is going on. After they present the case, I tell them that okay, what are the three things you will talk in front of the patients. So in this way, what I'm doing, I'm preparing them that what are the things or what are the update we need to give to patients and patients' family, rather than, I'm giving all the update. I'm doing all the talk at bedside because it's not helping them. They are not growing the confidence. In contrast, when I am talking with them after they present the case, they have like 3 or 4 plans they will talk about to the patient. Then they go, they talk to the patient. After that, they are done with that side. Then I jump in, I tell them that, okay, is there anything else I can talk about? So in this way, what is happening, I am having at I'm trying my level best to have that fine balance of supervision as well as autonomy. I'm giving my resident the autonomy. They are taking ownership of their patient care. They are giving all the update. They are telling what they are doing actively for that patient, as well as I'm there to give the message to the patient family, as well as to my resident that, okay, I'm here for you. I'm supervising. And if there is anything you do not know, I'm here to help you and support you. I believe, in this way, I'm observing them as well as in addition, patients also know that, okay, I am always there to take care of them, to jump in if there is anything is beyond the scope of that resident.
Fantastic. It's a great model. And you mentioned something, you recently been promoted to associate professor. And as you're thinking about those early career faculty who are just starting off, you mentioned that, we don't learn these things. Our brains are just, when we are practicing and learning, we are just sponging. We're just all the data, the facts, the figures are just being jammed in our brains, but we're often not taught fundamental leadership competencies of communication and negotiating and knowing ourselves and leading ourselves and building relationships, all those, if you will, air quotes, soft skills. So what advice do you have for early career faculty educators, clinicians and physician investigators who are trying to make sure that they're solid in their educational component of their lives? What kind of words or
Uh,
wisdom or like reflections do you share with them in addition to your WISE framework?
so in respect to your question, three things come to my mind. First, it is very much expected to have at least some imposter syndrome when an early career faculty is jumping through the transition from the senior resident to academician, from senior resident to early career faculty. So be mindful of it. You are not alone. There were a lot of distinguished educators. I can tell you they had the same feeling when they started. So take it that okay, it's natural process, it's your like, it's very much expected, but now what you can do about it. So two things I will recommend to do. First, you know try to have some niche, like for example, like maybe a couple of topics you are very good, so prepare those 10-15 minutes talk, or like read something so that you can build up your skill. So what is happening when we are on clinical schedule, when we are on inpatient surveys or clinic, it's very hectic. There is no way we can prepare any talk. We can have time to prepare the lecture to teach the residents. However, if you take preparation before that, okay, maybe in this week you will talk about this topic, or maybe next month when you are on medical floor, you are the attending physician, you will give this talk. So prepare maybe 2-3 topics, 10-15 minutes, not more than that. And thirdly, I will also focus on how you are starting your team. And my advice will be start strong. And what do I mean by that? Before you are going to see the patient on the first day, have at least 5 to 10 minutes, sit with your medical student, your intern and senior resident, ask them, okay, what is the right pronunciation of your name, maybe what are the biggest goal of they have of these rotation, what are their goal in 3 to 5 years, and what is their hobby. One question I ask them, like, what are the one quality they bring as a team member? I also love to ask another question, like what they do outside of the hospital, they feel that they will be able to bring here as a great team member. In this way, what is happening, just those 5-10 minutes, you are building connection, that human to human connection, and that will put you in a better space because you are building credibility. You are also creating psychological safety with the learners. So I will highly recommend to have those 15 minutes connecting with that so that you are starting strong with your team.
Wow. Oh, Farzana, you're a pro. Wow. I would love to hear you give us an example of how when you ask, tell me about your hobby. After you've said how you pronounce your name, what's your goal in this rotation, and then maybe 3 to 5 years, and what's a hobby or what's an avocation, and how can you bring that into work? What kinds of answers have you gotten from that query? And particularly, what is the application? Do you see light bulbs going off when people say, why is she asking us what our hobbies are? I mean, obviously she's trying to build relationships, but when you went that extra step and said, and how can you bring what you do outside of work into work, what are you hearing?
So far I had excellent positive feedback about it. And let me give you some examples. So one student told me that, okay, she's a runner and that is her hobby, that's she enjoy, and that give her calmness that she bring here as a team. Another student told me that, okay, she worked as an scribe in the ER, and like that is one of the things she used to do to earn extra money, that gave her like the skill that she's bringing here as a team. And a couple of other students told me, like they are like playing different sports, give them that, like how they will connect with the team. One student told me that I still remember when I asked him that, okay, what is your goal? Like, that is also one question I asked them before starting the rotation. He told me that not to lose his hair. I think that's a great goal, not to like get intimidated, not to get concerned. I think that is actually one of the biggest goals. And the very common feedback I got from my students, residents, that okay, when I take this time to know about themselves, to know their goal, to know their hobby, or truly what motivates them, they feel they are seen and heard. They feel that okay, they can ask me question, and they feel that they are part of the team. And I think that is very, very important, because if they do not feel that okay, they matters, if they do not feel that okay, whatever they are telling is helping the patients, they do not feel inspired and encouraged to learn as well as take care of patients.
Wow, you are so good at building connection. That must be one of your strong values or your Clifton strengths, because it's just so obvious in how you just naturally navigate that. I think it's what's so valuable about that, especially in today's modern medicine, when our world, remembering that we're all human beings. We all are all someone's daughter and son and mom and dad and partner and etc. We're human beings like onions. There's so many layers to us, and that we're not just a replaceable cog like a machine or a robot. So the alternative approach would be, all right, here's a new crop of, learners, and hollering and barking out orders like in the military, and everybody's looks the same and talks the same and dresses the same, and a faceless, soulless human being. And I'm not saying that about the military, but I'm just saying that that concept of making everyone the same and not acknowledging people as unique individuals with unique perspectives and histories and thought processes, that whole awareness of you're human beings and we're all human beings, and we all have tragedies and personal triumphs and personal stories, and that recognition of, as you said, seeing each other as real, that goes so far in terms of feeling valued and engaged and truly part of a team, such that when someone doesn't show up, you miss them. You know their name. You know something about them. You can then ask a follow-up. Hey, how was your vacation? How did your daughter do at soccer camp? Those small little things, I remember those things never used to be, I thought they were fluff and kind of a waste of time. And I'm always like, let's get down to business. And I really learned that, gosh, this is what it's all about. It's just relationships. And it's not like we're saying do it for an hour, not saying they'll hang out together. So I really appreciate that you're underlining how that's just so critical to your team.
And during that time when we are starting strong, when we are forming the team, that time also the educator is also communicating what is the expectation, what is the goal. For example, I tell them my expectation is that I want them to connect with the nurses, particularly for sick patients. They have to talk to them. They have to know was there anything overnight. They have to be accountable to communicate with nurses in a timely manner. For example, what happens sometimes if they are calling about a patient need, and if the resident or intern is not responding, that ultimately affect patient care. So when I am connecting with them after I know them, I also tell them, okay, this is my expectation that, okay, you will communicate with them regularly. You will return to their page and text within reasonable time frame. If they are dealing with any emergency, that's different thing. However, establishing that ground that, okay, what I want for my patients is goes a long, long way.
Mm.
And there is a study per ACGME, Clinical Learning Environment Review 2021, that showed that 50% of learners, they feel uncomfortable, they feel hesitant to ask for any help from their physician, from their attending. And so, when we are forming this team, we are building this psychological safety so that, if there is anything new happening, if they miss anything, they will have that courage to share. They will have that courage to acknowledge any mistake and learn from it. Because, ultimately, I always tell them that although maybe they are intern, they're the front liner of the patient. They are taking care of their patient. So how they are communicating with me if they miss anything, they need to be upfront of sharing that with me, because I tell them that, everybody make mistakes. I do not know everything, but we can always figure out as a team. So building that psychological safe environment, just beginning the team before seeing all those patients, is critically important.
Yeah. So that's so clear to me, that safety. You've said that a number of times. And you also said something that is very important. I want to underline is setting clear expectations, because the story you said earlier about the one person who was routinely showing up late and wasn't doing it out of, some might think you're being disrespectful, you're being passive aggressive, you are unreliable, you're lazy, whatever words would come into your head, my head, why someone who is, they may not hit, that's not anywhere near their intention. So I think I like how you said that, setting very clear expectations and then going maybe a step further. I expect you to be show up on time for work, maybe breeze over that. Well, let's talk about what does on time mean, because that is, we may be making, I'm sure I make assumptions all the time when but I told her to, submit that form. Well, did you tell her when or how or with this detail? No, I didn't think I had to. Well, okay, I'm making assumptions. So that to me is when I find myself getting in trouble, it's because I've skipped ahead a bunch of things and made a bunch of assumptions. So I really want to underline another gem you just said about clear expectations and making sure that's understood. And then, yeah, you can't go wrong when you've set that safety net of everybody feels like, hey, let's just talk it out. There's no point in time when you can't come to me and ask for clarification, ask for, further, information. Yeah, all good.
And we are not only like teaching them, because we are role model. Knowingly, unknowingly, they are picking up cues. They are learning so many things from us. Not only like the words, the language, the patient care knowledge. Also, how we are treating patient, how we are treating the nursing staff, the ancillary staff. Ultimately, we are shaping them. We are shaping their mindset, how they will round maybe after 1 year, how they will like take care of the patient. So this is very important. It's not only education. We are like role modeling, because, at some point it was very normal to like having ask them the very difficult question intentionally, and just making them shameful that okay, you do not know. But the time has changed. It's not the era anymore. Our current generation, it's not like before. When I was in my medical school, we used to like round 7-8 hours continuously, skipping lunch. But it's not the practical approach anymore. So we have to be mindful about it.
That's wonderful. Wonderful. Dr. Farzana Hoque, I just love our conversations. I'm so happy that you put out this paper. We're going to link to it in your podcast episode, The WISE Framework, Teaching Guide for Early Career Hospitalists. And I think I'm going to leave the parting comment to you, Farzana. And thank you so much for being here again.
Thank you so much for having me. It's always a pleasure to be here with you, Kim.
Join us next time on the Faculty Factory podcast.
Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.